we are going to discuss cyanosis. What is cyanosis? What is definition of cyanosis? Cyanosis is bluish discoloration of skin and mucous membrane due to presence of increased amount of reduced hemoglobin, presence of increased amount of reduced hemoglobin. In the definition of cyanosis, we have always mentioned the amount of reduced hemoglobin. It should be more than 5 gram, not milligram. It is gram, not milligram. Many students always make a mistake and say it is gram, but it's a milligram, but it is gram. Or reduced hemoglobin should be more than 30% of the total hemoglobin. Cyanosis start appearing when the oxygen saturation start dropping from less than 85%, and this oxygen saturation when this oxygen saturation becomes less than 65%, it is very critical. That is, it is intense cyanosis, and patient may go in spell, cyanotic spell. Cyanotic spell is the complication of the cyanosis. We will discuss the complication of the cyanosis or complication of the spell or recurrent spell in another lecture. But here less than 65% is very critical, and it can maybe become very deep blue. There are other abnormal hemoglobin pigment in the blood that also mimics like cyanosis, and when this is present in more than hemoglobinemia more than 1.5 gram per dl, and sulfhemoglobinemia when it is present more than 0.5 mg a gram per dl, and presence of carboxyhemoglobin in the blood also mimics like cyanosis. Carboxyhemoglobin most commonly present in a smoker. We will discuss differential cyanosis and the types of cyanosis in another lecture. So, to conclude, the cyanosis is bluish discoloration of skin and mucous membrane and the reduced hemoglobin should be more than 5 gram per deciliter, and or the reduced hemoglobin should be more than 30% of the total hemoglobin. Oxygen saturation should be less than 85%, and when oxygen saturation is less than 65%, it is very much critical and patient may go into the spell. Some cyanotic like condition which mimics this cyanosis, which appears like bluish discoloration of the skin, and that when the methemoglobinemia, that are the condition when methemoglobinemia is more than 1.5 gram per deciliter, and self-hemoglobinemia when more than 0.5 gram per deciliter and presence of carboxyhemoglobin, which is more common in the smoker, it appears like cyanosis. In another lecture, we will discuss differential cyanosis, what are the causes of differential cyanosis, peripheral cyanosis, what are the types, and central cyanosis, that is the types of the central cyanosis. Thanks for watching the video.